Have you experienced time where you have forgotten somebody's name or where you have placed the keys? Very common occurrence, but you need to also make sure that it's not something sinister. So if you're wondering if it could be something as serious as Alzheimer's, then I'd encourage you to watch this video completely. Welcome to Athena Women's Clinic YouTube channel. I'm Dr. Soma. Today we will talk about Alzheimer's, which is affecting many women worldwide. By the end of this video, I hope you do understand the causes, the symptoms, and some simple managements and preventive methods that can help reduce the risk of Alzheimer's. What is Alzheimer's? Alzheimer's is a type of dementia. So before we go further, what exactly is dementia? Dementia is a term that refers to decline in cognitive function that affects the day-to-day life of a person. 60 to 80% of causes of dementia is Alzheimer's. So this disease damages and destroys brain cells, leading to memory loss, confusion, and changes in behavior. It is a progressive condition, meaning it worsens over time. It affects older individuals, although it's not a normal process of aging. So what happens in Alzheimer's disease? Our brain is covered in neurons. So the communication between the neurons primarily occurs through chemical and electrical signals. In a person whose brain is affected with Alzheimer's disease, there are two important pathologies that happen: accumulation of amyloid plaque and tau tangles. So these are technical terms that are used in medical science. So amyloid plaques are abnormal proteins that cause destruction of the brain cells, and tau tangles are where the neurons or the fibers are twisted and destroyed. Statistics tell us that Alzheimer's are more common in women, primarily due to the longevity of a woman's lifespan, but also there can be genetic, hormonal, and environmental factors that come into play. The lifespan differences between a man and a woman, where a woman lives longer, the likelihood of developing the disease increases. The next predisposing factor in a woman is hormonal changes. As the woman undergoes menopause, the decline in the estrogen content also predisposes them to a higher risk of developing dementia and Alzheimer's. So there could be genetic predisposition to the development of this disease as coded by the APOE4 gene, and women are more commonly affected as compared to men and predisposing them to Alzheimer's. Alzheimer's disease progresses through various stages from preclinical, mild, moderate, to severe. So what is the preclinical stage? This is a stage where the changes in the brain are already happening, but there is no clinical manifestations, as in there is no symptoms or signs that is exhibited by the person. This is a stage where prevention becomes highly effective. Mild Alzheimer's or early stage or second stage of Alzheimer's. In this condition, there could be some simple tasks that may be forgotten, like trying to remember an appointment or trying to place a person's name. So these are simple tasks that could be forgotten, but it doesn't generally interfere with their day-to-day living and does not affect their independence yet. Moderate stage or third stage of Alzheimer's is wherein the tasks of daily living become more difficult due to forgetfulness. So they will need help with day-to-day tasks. They will have difficulty remembering faces, names, even in their familiar surroundings. So this may necessitate greater help from their family and friends to perform or to live a day-to-day living normally. The fourth stage or last stage of Alzheimer's is when the person completely loses the cognitive ability. So they are unable to recognize their own family members. They are unable to even speak coherently, necessitating 24/7 care for themselves. Recognizing the early signs of Alzheimer's is important, so preventive steps can be implemented with maximal effect. What are some of the symptoms? Memory loss, difficulty planning day-to-day schedule, confusion as to how you have to reach a destination or how you actually got there, forgetting the date, time, or orientation to where you are, and trouble with words, so vocabulary could be different, and poor judgment. So if you struggle with any of these symptoms, or if your loved one is struggling with any of these symptoms, please go ahead and organize a full check and have the evaluation performed. What can you do to protect your brain health? As you all know, there is no cure for Alzheimer's yet, but some basic steps can help prevent or reduce the incidence of Alzheimer's. So here are some of the important tips. First one is staying physically active. 30 minutes of daily physical activity is really important. Simple things like walking, swimming, yoga, or Pilates, whatever you like, but being consistent is really important. Eating a healthy diet comprising of lots of fruits, vegetables, whole grain foods, omega-3 fatty acids, all of them will help protect your brain as well. Improving your sleep, getting at least 7 to 8 hours of sleep every night will also help reduce your risk of developing Alzheimer's. If you do struggle with sleep apnea, make sure you get that treated as well. Managing stress, a very important one, through either meditation, breath work, or nature walks will also help you. Challenging your mind. How do you challenge your mind? By keeping it active, learning new skills, or doing some puzzles, or learning a new language would all increase your cognitive reserve. There is an app called Brain Track, which is like a little game that you can play, and also the information from that can be sent to your own health professional to see what your brain function looks like. Staying socially connected, a very important aspect to keep your brain going as well. So there are groups like Act, Belong, Commit, for which you can be part of and keep your brain active and reduce the incidence or risk of development of Alzheimer's. There are many ways, apps and websites available. I've just mentioned a few. Please go do your own research and look into it further. There are latest developments in testing. The genetic testing is available, although at a cost. If you really like, speak to your healthcare professional and get it organized. Coming to the treatment, is there actually any treatment that is available to cure Alzheimer's? No, not yet. They're all in research stage. But to help with some of the symptom management, there are some medications that are available, and there are experts who are dealing with this from whom you can definitely get the opinion and advice. Additional therapies like cognitive rehabilitation, physiotherapy, and psychotherapy may be required to help improve their overall functioning. So if this is something you need, again, please seek advice from your own healthcare professional, or you can visit us at athenawomensclinic.com.au to organize your care. Caring for someone with Alzheimer's can be quite daunting and exhausting. So it is important as a caregiver that you look after your own health as well. Alzheimer's is complex and a challenging disease, but there are ways to manage it and still have a meaningful life. So if you're concerned about your brain health, or if you notice changes in your memory or thinking, don't wait. Early diagnosis and intervention is important. So at Athena Women's Clinic, we do specialize in women's health, including memory and cognitive function. So if you would like more information or to make an appointment, visit athenawomensclinic.com.au. Thank you for watching this video. Hope the knowledge has helped you. If so, please don't forget to share and subscribe.